So I'm going to unshare my screen for a moment and bring myself up here. Hi, everybody. Welcome to Tri-Cities webinar on motivational interviewing. My name is Veronica Awadu, and I am an MHS for Tri-City Wellness Center. I've been working for Tri-City for 8 years now. I work at the Wellness Center where we have support groups. We have anything from the adult support to TAY, which is our transitional age youth. Right now we're offering support groups via telehealth. At the end of the webinar today, I'd like to offer you the website if you're interested in attending these support groups. If you have any questions, there is a Q&A button on the bottom of your screen that you should be able to click on if you have any questions during the webinar. There are a lot of information that we're going to try to cover in an hour. So again, welcome and thank you for joining us. I'm probably going to put myself off screen so you can be able to see my shared screen a little better. And we're going to get started. And again, thank you for joining us today. So motivational interviewing. What is motivational interviewing? It is a style of talking to people constructively about reducing their health risk and changing their behavior. So health risk can be anything from physical health to mental health. Or psychological. It's in any type of health that they want to change. It's a way of arranging conversation so that people talk themselves into change based on their own values and interest. Okay, so I have a question. How many are familiar with motivational interviewing? Okay. Anybody else? Great. Great. So we've got quite a few. That's pretty great. So for those that are, you'll be able to help me a little bit today. And those that are not, I'm hoping that we get some good information out to you today. So, and again, thank you for coming. MI evokes change through conversation. So evoking change can come in different ways. And in MI, we talk a little bit about the carrot and the stick, how you can, through the stick, it's more of a negative type of way. It is like losing your children or getting a negative diagnosis. And the carrot is more of constructive behavior change, comes through connecting through something that you value or you cherish or that's important to you. Okay, so. All right, so the underlying spirit of MI. So motivational interviewing has an underlying spirit. It's the partnership of compassion, acceptance, and partnership that evokes change. So partnership is you and as the person, either clinicians or it could be just you as a person, because I use MI with my family members all the time. So it's you with the other person, and who knows better about themselves than the person that has the desire to change. With acceptance, right? There's no judgment. Compassion, right? Everybody needs compassion. And all that creates the evoke of the spirit of motivational interviewing, right? It's the MI spirit of evoking change in a person. So ambivalence is very normal during this time of change. Most people want to change, but then they don't want to change. So at this point, it's normal for clients to experience this. Waiting to change is not really ready to. I want to stop smoking, but my friends smoke on our breaks. That's what we do at work. We take smoke breaks. I want to quit drinking, but what would I do on the weekends, right? That's when I hang out. I want my kids back, but all these classes and the social worker and the way they treat me. I want to lose weight, but my doctor says I should, but I don't know, it's too hard. So yes, I want to change, but it's, I don't want to. Ambivalence is normal. Clients usually enter treatment with fluctuating and conflicting motivations. They want to change, but then they don't want to change. And so working with ambivalence is working with the heart of the problem. So, and as you can see on the screen, the lack of motivation can be viewed as unresolved ambivalence. So wanting to change is one of the steps in moving forward with MI, with the spirit of MI. Change talk. So when you get into change talk, one of the things that they talk about is recognizing the problem, right? There is a lot of times that the client recognized or the person recognized that they have a problem, but they're not able to verbalize it, or they're not ready, excuse me, to admit that there is a problem, right? I don't need anger management. I'm not angry. So it's recognizing that there is a problem. Change talk comes with expressing concern. If I don't stop doing this, other health issues are going to occur. If I don't stop getting in trouble, there's no way that I can provide, for my family. If I continue to involved in this behavior, then it's going to lead to other negative things in my life. So expressing concern. Stating an intention to change. That's letting others know that I want to do this. And to me, stating intention is kind of like setting a goal. If you intend to change, then you're setting kind of a goal to make that change. And being optimistic. I've done this before. I know that I can do this again. All right. So I really like this part of MI. Is there any questions so far?
None so far.
Okay. All right. So I really like this part of MI. It's pre-contemplation, contemplation, preparation, and action. And this chart kind of goes through the changes that people go through when they're involved in change talk. There's several levels of change. It begins with the preparatory change, thinking about the change that they want to make and moving forward toward an action in that change, which is mobilizing the action. So pre-contemplation would be thinking about making the change. Like I'm contemplating and I have a desire to change, right? So desire is, I wish I could kick this habit. I wish I could get my kids back. I wish that I could, lose 50 pounds. That's a desire to change. I wish that I could do these things. Change is always easy. And when clients come to us with a strong desire to make a physical or a life change, a lot of times sometimes they know the direction, but a lot of times they know what they want to do, but it's just finding the direction of which way they want to go to make that change. So a desire is, I wish that I could like kick the habit or do something to make the change. The ability to change is the next level. I can stop whenever I want, or I can change this thing. I can do things differently to make this better. So the ability to change, or even back to, I've done this before, I know that I can do it again. I've changed this about myself. I know that I can change it again. So that's the ability to change. And a lot of times it's a little bit of, the changes seems like they move pretty quick, but it takes time sometimes to get from desire to talking them into, or to talk with them about the ability, and they know that they can't. So the next phase is in the yellow. That would be the reasons that they engage in the behavior. So they will give you the reasons of, I do this because it makes me feel better. I feel that this is something that I've done all the time, and it's a part of our culture. This is something that we do in our neighborhood. So the reasons they engage in the behavior is a lot of times a part of the change talk. And we'll get into the questions later on that we ask in order to move them through the phases of change, in order to get them to do the change talk, to get them to taking the action for the necessary steps. So next is the area of need. I need to change because I want my kids back. I need to change because everybody says that I'm angry, and when I go places, it's isolating me from others. So the need to change is the next step. The commitment to the change is making themselves a promise. I promise that I won't do this again, or I promise that I'll attend, or I'll do this, or I'll do that. So making the commitment, and it's not you having them commit, it's them making their own commitment. Because I think everybody knows that when a person makes a promise to themselves, and they're the ones that says the change, it's a lot more serious to them if they make the commitment, as opposed to someone telling them what to do. So commitment to change, making their own commitment. The next phase is activation. I am willing to take the classes. I am willing to attend the groups. I am willing to stop smoking. I'm willing to stop whatever the negative behavior is, drinking, or I'm willing to start exercising. Whatever the activation or the behavior is, you're willing to do those things to move to the next step. And of course, taking steps is the final part of this. Attending a meeting, taking classes, or following through with a plan. And actually taking steps is the phase of when they've already started their plan, and you're pretty much just checking up on them or meeting with them to see how everything is going in that phase of the change talk. Okay. So some of the questions to pull levels of change talk. For desire, I'm not going to read all of them. These are just to give you examples. For desire, is how badly do you want this, or do you want that? Maybe how would you like things to be different? The ability would be, how would you do that if you wanted to? What do you think you might be able to change? And change talk questions like, what concerns do you have about this thing? And what concerns does your spouse, partner, or your family have about your, overeating or drinking or whatever it is? What has this thing cost you for reasons? The need to change, what needs to happen? The commitment to change is, how are you going to do that? Or what would that look like? And the commitment to change, the activation, a couple of questions is, how are you going to do that? And what do you need to do this first. And then again, the taking the steps, as we were saying in the last slide, is when they've actually engaged in the change and they've taken steps toward their goal, is how's it going and what's working. Okay? All right. So the building blocks to creating questions, like the ones you just saw on the last slide, for making change comes with OARS. And if you've noticed in the last slides, those were open-ended questions. They were not yes or no questions. Yes or no questions sometimes lead to a simple answer, and then they've gone on. You want to open up for a conversation. So opening questions leaves conversations. An example would be, how was your day, as opposed to, did you have a good day? So did you have a good day is like yes or no. And how was your day? Even if they say it was okay, it was good, it still leaves the conversation kind of open, to what's going on, as opposed to just closing it off. So open-ended questions are very important. Let's see, with open-ended questions, we try to avoid the why question unless there's something positive attached to it, because sometimes the question of why did you do that, or why are you, can seem a little confrontative, as opposed to the what or how type of questions. Okay. I'll give an example. It says, did you find it difficult to follow your doctor's directive this week? So sometimes when we meet with clients or with people that have medical conditions, did you find it hard to meet with your doctor's directive this week? And the answer to that question would be either yes or no. And then changing it to an open-ended question would be, what was not so difficult, or what was difficult about meeting with your doctor this week? Or how did you do with the doctor's directive this week? So now, you've opened it up to a conversation. All right. Affirmations. Again, affirmations are good. We have a group where they at the Wellness Center, where they're always giving affirmations. They're positive affirmations and encouragement. And so we want to affirm when we're talking to people, when they're giving us conversation, what they are saying. We want to let them know that we are listening, which leads us to reflective listening. And I'm going to go over these in a little bit. I'm just giving you the OARS from the beginning. So reflective listening is kind of paraphrasing and giving them back what they've said, to let them know that I'm listening to you. And then, of course, there's a summary. So those are the OARS. And summary is a little more like taking everything together, having them put things kind of in the way that they want it. And then you're basically allowing them to summarize what you guys have discussed. And then, from there, coming up with a plan. So, and engaging in open-ended questions, which leads to answers that are not yes or no. It keeps the person talking and encourages them through about what is being said, instead of just closing off the questions. For the affirmation, you want to remind the person that they are doing a great job, right? So you're encouraging, you're supporting their persistence, their proven strength. You're assisting and seeing the positive and encouraging that whatever their effort is be continued, right? I had a participant that she would stop smoking from her cigarette at breakfast to the next cigarette at lunch, right? And to me, she was doing great, because that was her goal, to stop smoking from the cigarette from breakfast to lunch. And then she would have that lunch cigarette and then have a break cigarette and then have her next cigarette after that. And she stopped smoking from that cigarette until dinner time. And then she stopped smoking until, time to go to bed. And so each small effort should be like encouraged, because, she stopped smoking at some period of time. And to me, that was encouraging for her. So it was encouraging for me. So it's affirming. You did a great job, it seems like, this is really working, because eventually you never know. She may stop smoking from breakfast to, all the way to dinner, or that just be the cigarette of the day. And eventually, no smoking at all. So, so affirming, reflective listening, to me is reaffirming what the person is saying. For example, I had to take 2 blocks this morning, and in the heat, to get to a station to charge my phone, to call you for this meeting. And so my reply would be, I really appreciate you making our meeting today. It sounds like you had a bit of a challenge getting here, and I thank you for making the call. So all the stuff they said sound like a challenge. So I would give them back what they said, but more in a positive way, and show appreciation. Thank you for being able to make it here today. And then in summarizing, you never give an opinion, reminding the client about the major decision points that they had made, the plan of action that they had made, and their own reasons that they had given for making the change. And so it's not in a way of, you said that, you're going to do this, this, and this, right? It's more of, well, we discussed in our meeting last week, and, some of the changes that you came up with, I thought they were pretty positive. And so how are you doing in that area? So it's reaffirming or summarizing everything to see how they're doing as part of change. Has anybody ever used open-ended questions or any of these things, affirmations even, in dealing with anybody? It could be another person, a client, or anything like that. Is anybody? Okay. Okay. And did you find it to be more effective? Okay. Okay. All right. And for me, it kind of gets to, it gets everything like out of the way. I use this, again, I use this at home, even with my children and my granddaughter. She's 13, and 13-year-olds, I don't know if anybody knows this, 13-year-old girls are pretty scary. And so when talking to her, a lot of times she's all over the place and I don't know where she's coming from. And so I have to like calm myself down and start asking like open-ended questions. And for me, I kind of like lose the concentration of it. It's like, instead of affirming her, I'm agreeing with her with everything she's saying. Again, 13-year-old girls are kind of scary, but I do the reflective listening and I give her back what she said. Well, it sounds like you're having a hard time with school today. And she'll say, no, that's not what I said. And it's like, oh my God, let me figure out something. But using reflect, eventually I can get it all in the box and get it organized, and it actually really works. So the open-ended question, the affirmation, after a while, you put it in that box and it really, really works. Okay. So the confidence readiness ruler. We have a staff member. It's not really the ruler that you see on the screen that she uses, but during her women's group, she starts the group with, on a scale of 1 to 10, how are you feeling today? And I think that's pretty awesome. And most of the participants will say, I'm at a 5 or I'm at a 6, and she say, okay, so we're going to see what we can do today to get you at a better number. So I know that when you're using this one-on-one, it's how important it is for you to change and on my screen I have drinking, but your behavior or your, smoking or whatever it is, how important it is for you to change that, right? And on the readiness scale, you can give 1 to 10, and they'll choose a number. And it's so, how come you didn't get it a lower number, right? So why isn't it least important to you? Or why is it such a low number, or why is it such a high number? It can go either way, right? What would it take to get a higher number? Or what would it take for me, even in a positive, to get a lower number, right? Why might your spouse or your mother or somebody that's important to you give you, what number would they give you on the scale? And why would you think they would give you a higher or a lower number? And I like the readiness scale because it uses the numbers to kind of let you know where that person is at the time of what they're feeling. So with this scale in that group, 10 is best and 1 is the lowest. And if there's somebody that's at a 3, usually that is when we say, is there something you want to talk to us about, like maybe after a group? And sometimes it's not something they want to talk about to everyone in the group, but you know, and we give them like information and resources and things like that. So, but I love using the confidence scale. It really helps. So, okay. So, and I'm going to pause again to see if anyone has any questions, any comments, or anything they want to add.
None in the Q&A box, but anyone is welcome to ask questions in there if you have any throughout.
Okay. All right, thank you. All right. So we're going to go to rolling with resistance. So we all have people in our lives that at any given time, they do whatever we want, whenever we want it, right? No? Okay, I think there's a question. So, let me get back to, sorry about that, guys. So, rolling with resistance. It's impossible. I'm going to give you an example of a client and a counselor's conversation, and then we'll talk a little bit about rolling with resistance. So, the client says it's impossible to find a job. Nobody wants to hire a guy with a record. The first counselor says there's a lot of jobs out there, even for people on supervision. In fact, most offenders are able to find jobs. Comes off a little confrontational and a little less effective, right? Counselor 2 says it can be much more difficult for someone on supervision to find a job. Sure. How do you think you might go about that? So he ends with a question. So they begin to talk about how he can make the change in looking for an employment. One of the reasons why I like this slide and I chose this one is for the rolling with resistance is at the Wellness Center, I work in employment, and we have a lot of folks that come in that need help in finding jobs. And there's always, like, you know, barriers that that we meet or that we have with them looking for employment. And effectively, we have helped them find employment that matches what they're looking for. And we use a lot of motivational interviewing in employment. I use it in money management, which is one of the groups that we have. And I know that sounds weird, like how can you use MI in money management? We use it all the time with participants that come in and they talk about their finances and how the money is tight and that type of thing. And one of the things we ask is, so what one thing can you change to to change your finances. And a lot of times they make a list and they take things off that are not necessary. And then when we meet again a month later, they tell us how the money has changed and the finances has changed. So it's them coming up with a solution that can change things in their life. So rolling with resistance is not necessarily agreeing with what a person says, but it's allowing them to feel how they feel, without judging it, and without making a comment to it. And when I say not making comment to it, I mean, like if they're telling you that I hate being in anger management. I don't want to be here. I'm only here because the judge gave me, 100 classes. I'm just making up a number. I'm pretty sure it's not 100 classes, but 100 classes, and I'm only here for that reason, And I think in most groups, we roll with resistance every day, right? So they don't want to be there, and they have the reasons why, and this thing. And most times it's met with something positive, like, well, I'm glad you're here. Thank you for coming to the group. And we're glad you're here. Well, I don't need this group. It's like, okay, and we go on with, allowing them to vent. And then, you move on to the next person. And it's just rolling with the resistance. And I've seen it happen over time that after attending group after group after group, they're no longer resistive, but they're actually sharing information, and not just sharing the information of, about themselves, but taking the learning tools that they've gotten from others in the group and actually using it. And when they come back, letting the group know how those tools have worked. So it's not, directively being confrontational with the person you're talking to or client. It's not telling them what to do. It's allowing them, to feel what they feel, and then, kind of opening questions that allow them to talk themselves again into their own change. And it's using their values along with their beliefs, if you will, that allows them to talk themselves into their change. Okay. So we're going to take a minute, and I have one question that I wanted to ask is, I think we have a question. Chris, is there a question on there?
Yes. Do you have a suggestion on remaining reflective and not becoming judgmental in rolling with resistance?
A suggestion on remaining reflective?
Not being judgmental when you're dealing with the resistance.
Okay, so if they're yelling and screaming, it is, and sometimes it's hard to be calm. A suggestion with rolling with resistance and being objective, I would say that if they're like being what's the word? I'm trying to think of an example of rolling with resistance. Okay, I'm going to use drinking as an example, if that's okay. So one of the things was, I drink because I want to be sociable, and I don't have a problem with drinking. I drink because I want to be sociable. Okay, so it's like, what has drinking to be sociable? How has that affected? Your work how has it affected your work in any way? And they would say, well, sometimes I go in late, because, I'm hungover or something to that effect. So what do you normally do when you have to, so the open-ended questions, getting them to recognize, not you being judgmental that they have a drinking problem, but getting them to recognize that there may be a problem, because you're not telling them there's a problem, but that there may be a problem. Is that a good enough example? I was trying to think of a good one. Is that one okay? Did I answer the question?
Yeah, I feel like you did.
Okay.
And it might also have a impact if, you have a personal history with drinking and you have a real hard time with accepting that someone doesn't want to stop drinking.
Right.
Yeah, and so trying to put aside those personal beliefs or personal viewpoints, and really accepting that their experience might not be the same as yours.
Exactly. Exactly. So, um, and even if there are some times that there's experiences that we don't share with our clients or with other people that are going through stuff. Again, like I said, I use motivational interviewing also, like in my personal life. So if there's like stuff going on and my son wants to talk, and I may not understand his view from being a man and the thing that he's going through, but I can still listen and try to offer uh, affirmations and encouragement without judging, some of the stuff that's happening. Like Chris says that if you have a little bit of experience, and it is setting your own judgment aside as well. So if you do have the experience, it's setting your own experience and your own judgment aside and allowing them to express themselves in a safe environment that's judgment free, right? So I give another example with rolling with resistance is okay, so the client is saying the whole thing is about money. All you guys want is my money. And the clinician says, it seems like maybe we care about, and this is the reflective listening. They're reinstating, maybe it seems like maybe we care more about the money than what your successes are, is the statement that they're repeating back. Or you use you feel statements, like you feel maybe we don't understand, and it's okay to say, well, maybe you feel we don't understand. What is it that you feel that we don't understand about this situation and what's going on, right? And that's part of rolling with resistance. It's still using the open-ended questions, without judgment. Does anybody have any more questions about rolling with resistance? Okay. All right, so we're going to move on. Okay, so I want to take a minute for like a small practice. There was a lot of things in this MI that I really liked. I had to pull some stuff out to take some of the things that I feel that would be more effective. And so as a practice, one of the things is I'd like for you as a person to think about an actual change that you would want to make. If you can take a minute to think about the actual change that you want to make and how you would apply some of the things that we went over right now today to that change that you want to apply. So I'm going to, if it's okay, I'm just going to take like a few minutes, and then I want in the Q&A section to, if you can, to put in like maybe something you would like to change.
Someone asked if you could repeat what it is that you were asking for.
Okay, so I want you to take a minute and think about an actual change that you would want to make. I'm going to give it a minute, and then I'm going to ask you just like a few questions, and then based on the motivational interviewing, because I just want to kind of like review the information that we did. So a couple of people said overthinking. Losing weight, that's mine too. And changing my hair. I change my hair every month. You can ask anybody that I work with. I'm just unrecognizable. Every time you see me, I have like different hair. Anybody else? Okay. So using the tools of changing my relationship. Okay. That's a good one. That's a deep one. Yeah. Change that you want to make. So using the tools, and those are all good ones. And thank you guys for putting those there. Those are all good ones. So in thinking about the changes that you would want to make, asking the questions that you saw today in MI, there's a desire to change. You've already expressed that, those things that you've put in the question box, right? You know you have the ability to change, right? If you've had experience with this, right? You've done it before, so you have the ability to change. The reason for change, I'm not going to ask you to give me the reason for change. And they use the acronym DARN, D-A-R-N, so desirability, reason, and then the need for change, right? So the need for the change. And then I'm going to go like a little further and say that even though you're using this for the pre-contemplation and the contemplation, and again, using that screen that I showed you with all the colors on it, the desire and the need for change, I'm going to push and say the reason, not just the reason and the need for change, but the action is how do you go about, what is your plan to make those changes, right? And using the things that you've seen today, you know, the open-ended questions, you know. So for an example, you want to, I want to lose weight. I'm going to go with the losing the weight thing. The open-ended question would be, I have a desire. I know that I can do it. I've lost weight before. And the reason I want to do it is because, you know, I want to wear my clothes. In my closet, I have a size 7 to a size blah, 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 right? And I'm tired of being in the blah, blah, blah. So I want to be back in the middle size. So what can I do to make those changes, right? And so we already know kind of like what we have to do to make the change, but to have someone to encourage and affirm us, right, in making those changes. And one of the other things is to have, like I said, we have support, getting the support for the changes, helping one another is a good part of making the changes. So getting through the DARN, the query extremes, I think that for the query extremes, I think that those are like questions that are a bit more extreme than just the regular motivational interviewing questions. It's supposed to continue on as it has been. These will be the questions, you know, for those that are a little more hardcore, that are not ready to change. So suppose you continue on the way it's been now. What do you think the outcome, what do you think is going to happen? Those are querying questions. What do you think about, or what do you think could be the best results if you did make the change? And what do you think could be the worst results? So those are the querying extreme questions. I know you see that on the screen. I don't think I had querying up there. Looking back is another one. We don't really use looking back. Do you remember when things were going well for you and what has changed? So I know that at the Wellness Center and the groups that I sit in, we don't look at the back. We try to take a leap forward with the more positive. Another one of the looking back questions would be, what were things like before you started doing what you're doing compared to what they are now, you know? So it's kind of backtracking. That's what the looking back is. Making reflections is good. It goes with the reflective listening. It's taking what they're saying and letting them know that you are listening to them. The importance ruler is another thing. Like I said, I love that thing. You don't have to do it across. You can actually do it up and down on a scale of 1 to 10. And then exploring goals and values. And that's real important to a lot of our participants and a lot of people that you talk to. What are their goals and their values? What is their goal for this change? You know, what do you want to see the outcome to be in all of this? So I'd like to encourage you. This is pretty much the wrap up of the motivational interviewing that I have for you today. I'd like to encourage you to take time and use this example. Think about an actual change for those that were not able to, to chime in on the Q&A. An actual change that you'd like to make, and use the MI, or in our little micro skill thing, and it does work. So, do I have any questions, or anybody have questions for me?
Just an encouragement that the presentation makes MI feel more comfortable. The previous training seemed more clinical and difficult to implement, so they wanted to thank you.
Oh, thank you. Thank you. I wanted to share the information also and to encourage those that the Wellness Center is still doing groups. Our website, I think, is it okay, Chris, if I give the website?
Yes, please do.
Okay, it's www.tricitymhs.org if you're interested in any of the groups that we have, telehealth, or in any more webinars that are actually coming up. It's going to be on that site. And hi, here I am. And I thank you all for attending today. And if there's no more questions.
We did actually have another question come up.
Okay.
What type of example would you use if you had a rocky relationship with a child in the past, but want to build a relationship with them now?
Okay.
Any ideas on that?
So again, using MI, I would open a conversation with one of the what questions. Why and how would be a little more confrontative, like why are we not, talking, or how did, something to that effect. But a what question would be more or less like, what can we do, or what, I'm trying to think of something. Let me see. I know Gamil is here. Help me out, Gamil. Gamil, are you still here?
Yeah, I'm here.
Okay. They're looking for a open-ended question that, can you repeat the question again, Chris?
Yeah, so what type of example would you use if you had a rocky relationship with a child in the past, but want to build a relationship with them now?
I think you were on the right path, Veronica. I mean, just asking the what question, like what would, make our interactions more fruitful? What would you like to get out of our new relationships? So really, I think putting the onus back on the child, and just making that child feel like that they're being heard. Like, okay, what is it that you would like out of this relationship versus me as a parent, or me as a grandparent or an authority figure telling the child how this relation is going to work, because obviously that has been the interaction in the past. So you probably want to start, and clinicians are notorious for doing this. It's like they have this saying, like, start where the client is. So you would probably want to start where this grandchild or this child is, and seeing, instead of, like Veronica was saying, instead of focusing on the past, looking backwards, focusing on, like, okay, well, we're here now. How do we move forward? So hopefully that gives you some ideas on some of the stuff that you can start with to engage back with that individual child.
Thank you. Any other questions? Was that okay for the person that had asked the question?
Yeah, the person responded that it helps. Thank you.
Okay. Is there any other questions?
No, but I did want to mention, if anyone attending this webinar does need support, in addition to the services at the Wellness Center, we also are available. Tri-City is open. And if you need someone to talk to, you're welcome to call me. My name is Chris. And you can ask for me at 909-623-6131. And we can connect you with one of our peer mentors or our volunteers. If you just need someone to talk to, maybe you are trying to make some changes in your life and you'd like some support through that. So you are welcome to reach out to Tri-City and we can do that for you. So I just wanted to mention that as well. And that's it for me, Veronica.
Okay. I don't know. I saw a question that are these slides going to be available for anyone?
Yes, and I did answer it on the thing, but I think it's worth mentioning. All of our webinars, including this one, are available on our Tri-City website. So that's tricitymhs.org. And if you go up to the services and go to community, there's a community mental health trainings. All these presentations that we've done, I think this might be our, I don't know, 8th or 9th webinar that we've done. All of those are available online, so you can access all the information again if you need it.
Okay. Thank you everyone for joining us today. I hope that for those that are the first time you got new information, and those that have come in again, I thank you for supporting, and have a really great rest of the week. Okay.